Hello students, my name is Liz Attia and today's topic we're talking about professional-patient relationships and veracity. So professional-patient relationships and specifically veracity. So veracity in terms of a definition is the duty one has to tell the truth. And in healthcare ethics, there are 3 reasons to tell the truth. I mean, clearly from a legal perspective, there are 2, but looking at it from an ethical position. Why? Because it's a manifestation of respect for people as persons, to respect their right for accurate information. From a clinical perspective, it improves outcomes, because people are then able to make informed decisions about their care. So it has a positive effect on treatment and health outcomes. It's central to maintaining a trusting relationship between healthcare provider and patient. The vast majority of patients wish to be told the truth about all aspects of their health care. There are many reasons based in the literature why health professionals might not tell the truth to their patients, and they're not always based on self-interest or mistake, or covering mistake, I guess. The first is that the therapist thinks the patient does not want to know the truth, or can't handle the truth, or can't understand the truth, that it might go against the patient's own culture or the patient's values, that there might be an error in some way and it's difficult for the professional to actually admit it. It might be about the practitioner's own lack of skill in communicating the intricacies or the sensitive information, and so it's glossed over or it's watered down, and it's not imparted with accuracy. Or that the therapist might think that the patient's so fragile in terms of their mental health or their psychological stability that they're not able to handle the truth, if you like. And there's some benevolent deception or therapeutic privilege that in the interests of the patient, the information is actually withheld from them. I guess I'd ask you to consider what that might mean in practice. And if we actually look at some public health considerations here as it relates, for example, to vaccination, let's talk about this for just a moment. There are many people who are concerned with the side effects of vaccination, and you might actually have your own opinions about whether vaccination is a necessary evil, or whether it, the risks far outweigh the benefits far outweigh the risks. But if you look at some of the empirical evidence, with the measles vaccination, for example, there's a 1 in 1 million chance that people vaccinated will experience a severe or life-threatening reaction. Public health ethicists often use a consequentialist or utilitarian argument to justify the risk. So they say, based on the greatest good for the greatest number of people, the 1 in 1 million chance doesn't justify giving that information to people, because all you'll do is actually make people scared. You'll create some concern with respect to vaccination, and then you're actually going to lose the benefit of the herd immunity. So the data with respect to the health risks of vaccination, if you look at the process even by which you as a health consumer were actually informed, most people would actually say, well, really, they weren't given a lot of information. And if they were given information, it was in fine print at the very end of a leaflet or a fact sheet that wasn't explained to them. And so this concept of informed consent becomes questionable at law, certainly. The same sort of applies when we actually talk about fluoridation of water. And once again, from a utilitarian perspective and the consequences, public health ethicists would actually say, well, the benefits of fluoridation in water far outweigh any risks to health consequences. And so why would you actually scare people and tell them any adverse reaction? Because it's so inconsequential in terms of the data that, in fact, the benefits of disclosure and veracity in this instance would not be justified by those who would actually then decide to lobby against or to not engage then in the treatment. So I guess I'll leave you with the question, does introducing fluoride into the New South Wales water supply adhere to public health ethical guidelines about full disclosure of information? We see often in terms of health promotion and autonomy, this idea of veracity being compromised. Why? Well, if we look back to the definition of what truth-telling is, the influence, persuasion, regulation, and sometimes coercion that we use in public health and health promotion for beneficent reasons would compromise that concept of veracity. So regulations, sometimes quite coercive, can undermine a person's autonomy. Take cigarette packaging, for example. So many people feel that autonomy is trespassed when they're subjected to the emotional manipulation imposed upon them by cigarette warning labels and the plain packaging rules. Similarly, most recently where we have our smoke-free zones and smoke-free zones in public places, that's a clear breach of people's autonomy, being the boss of oneself, one's individual sovereignty, and yet in the interests of public health, that would actually be justified. So I'm asking you to consider here where health promotion actually bridges the line to be marketing, and whether there is truth-telling in that health promotion initiatives, in the concepts of the spirit of veracity and what we actually mean. Some would actually say, and this video is uploaded for you in your material for this week, some would actually say that individual autonomy is most important, and other would argue, well, listen, really, if there is an inconsistency there between population health outcomes and the benefits of public health and individual autonomy, then based on a utilitarian philosophy and thinking, public health must actually take precedence. So, as I mentioned, influence, persuasion, regulation and coercion are often used in public health and health promotion for beneficent reasons. And where health promoters use persuasion and rhetoric, it also undermines the extent to which truth is communicated to the public. So what do we mean by rhetoric? Well, it's using facts and figures in persuasive ways, and it's often done by public health and health promotion practitioners. Thank you, students. That brings today's topic to an end.